Collection of Prometric Exam for Nurses, 2021 to 2022. Infection Control. 22. Which of the following is an example of epidemic point source? A. Tuberculosis. B. Public Health Agency. C. Contaminated water source. D. Communicable disease pavilion. The answer is C. Contaminated water source. 23. A 32-year-old man develops chronic productive cough. He has not been feeling hungry and has lost 3 kilograms of body weight in the past 3 weeks. On examination of his lung fields, there was diminished breath sound and widespread crackles. An early morning sputum culture was sent to the lab. A. Droplet. B. Contact. C. Airborne. The answer is C. Airborne. 24. An 8-year-old man is diagnosed with tuberculosis, TB, in a negative pressure room. Which of the following should wear a face mask? A. A patient's healthcare providers. B. All people who enter the patient's room. C. Person has close contact with the patient. D. Family members who are at risk of infection. The answer is B. All people who enter the patient's room. 25. A nurse working in the medical unit is preparing with droplet precaution measures in place. What is the correct sequence for putting the equipment on? A. Face mask, gown, eyewear, and gloves. B. Gown, face mask, eyewear, and gloves. C. Eyewear, clothes, face mask, and gown. D. Gloves, gown, face mask, and eyewear. The answer is B. Gown, face mask, eyewear, and gloves. 26. A nurse working in the medical unit is going out, removing, with droplet precaution measures in place. What is the correct sequence for putting the equipment off? A. Face mask, gown, eyewear, and gloves. B. Gown, face mask, eyewear, and gloves. C. Eyewear, clothes, face mask, and gown. D. Gloves, eyewear, gown, and face mask. The answer is D. Gloves, eyewear, gown, and face mask. 27. Mr. X attended in an outpatient clinic with symptoms of shortness of breath, diarrhea, and severe respiratory distress. Which of the following is the best diagnosis for Mr. X's case? A. Coronavirus. B. Swine flu. C. Zika virus. D. Hepatitis. The answer is A. Coronavirus. 28. A nurse receives a telephone call from the admission office of the hospital and is told that a patient with streptococcal meningitis will be admitted to the medical unit. The nurse is planning to apply infection control measures to the patient. Which type of isolation precaution the nurse must observe? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Standard precautions. The answer is A. Droplet precautions. 30. A 35-year-old patient was admitted to a medical ward with a confirmed diagnosis of meningococcal infection. Which of the following infection control preventions the nurse should implement? A. Droplet precaution. B. Contact precaution. C. Airborne precaution. D. Standard precaution. The answer is A. Droplet precaution. 31. A 16-month-old child is hospitalized in the intensive care unit with multi-resistant sepsis. On the 3rd day, she had explosive diarrhea. A stool sample was sent to the laboratory for difficult investigation. Which of the following transmission-based precaution is most appropriate? A. Combination of airborne and droplet. B. Contact. C. Droplet. D. Airborne. The answer is B. Contact. 32. Which of the following is the most effective infection control precaution to prevent nosocomial infection? A. Hand washing before and after patient contact. B. Wearing gloves and mask for direct patient care. C. Isolation precaution. D. Broad-spectrum antibiotic. The answer is A. Hand washing before and after patient contact. 33. Mantoux test done for a patient result was 6.5 centimeters. It consider A. Latent. B. Suspected. C. Active. The answer is B. Suspected. 34. When planning discharge teaching for a patient hospitalized for treatment of the third burns over 30% of the body, a nurse knows it is most important to include instructions regarding the loss of large amounts of serum occurring with burns and the resulting loss of immune function. Which of the following instructions should be included? A. Wash hands frequently each day. B. Wear supplemental oxygen at night. C. Wear masks while in public spaces. D. Take a multiple vitamin tablet at night. The answer is A. Wash hands frequently each day. 35. An infection control nurse notices purulent exudates, redness, and tenderness on the surgical wound site in postoperative patients in a surgical unit. She discussed with the ward nurse and emphasized that wound infection after the surgery can be prevented. Which of the following is the best possible action to minimize the incidence of wound infection? A. Perform assessment of pain on the wound site. B. Wash hands before and after each patient activity. C. Encourage adequate intake and early ambulation. The answer is B. Wash hand before and after each patient activity. 36. A patient in surgical was transferred to an isolation room after the wound swab was confirmed to have methicillin-resistant Staphylococcus aureus MRSA. Which of the following measures should the nurse take to prevent infection in the ward? A. Clean the wound 3 times a day. B. Discard all soiled dressing into a waste bag. C. Instruct the patient to wash hands regularly. D. Wear gloves and gown on every entry into the room. The answer is D. Wear gloves and gown on every entry into the room. 37. Medical asepsis requires which of the following hand washing techniques? A. Use hot water to ensure that pathogens are killed. B. Use circular motion washing from clean to dirty areas. C. Rinse soap off keeping hands and forearms lower than downs. D. Hands shall be held higher than elbows and scrub. The answer is D. Hands shall be held higher than elbows and scrub. 38. A 45-year-old patient was admitted with pulmonary tuberculosis. The unit nurse placed the patient in an isolation room with negative air pressure and prepared all the personal protective equipment at the entrance of the room. What type of precaution measure has the nurse activated? A. Contact. B. Droplet. C. Airborne. D. Standard. The answer is C. Airborne. 39. To reduce the risk of transmitting methicillin-resistant Staphylococcus aureus, MRSA, from an infected wound, which of the following precautions should be implemented? A. Airborne. B. Contact. C. Droplet. D. Reverse isolation. The answer is B. Contact. 40. 45-year-old patient is admitted with pulmonary tuberculosis. The unit nurse placed the patient in isolation room with negative air pressure and prepared all PPE at the entrance of the room. Which of the following PPE is the most important for the nurse when caring for this patient? A. Hair cover. B. Sterile gloves. C. N95 respirator. D. Protective goggle. The answer is C. N95 respirator.